I am Dr. Andy Keith. It is very nice to be here, and I want to thank Lanisha for the invite of this little lecture tonight. We're going to be talking about regenerative medicine, which is my passion. I love it. Let me give you first a little background about myself and what we'll talk about tonight. So as I said, I'm Dr. Andrew Keith. I've been a chiropractor for 40 years, and I always had a desire as a chiropractor to learn more things. So I studied nutrition, sports injuries, and several different things. And then I felt like I was still lacking. And so I decided to research regenerative medicine. And I ended up forming a medical corporation. I had an orthopedic surgeon with me and a PA and some other individuals to help broaden the scope of what we could do in the office. And because of the holistic background of the chiropractic and the other people that were there, we began really focused in the regenerative medicine type of practice. So I went back to school after that so that I could do more of the parts of the office. I didn't like doing consults with patients and then having to send them off to somebody else to get treated. I prefer to treat people in much better hands-on than I am administrative. So I went back to school and became an RN and then a nurse practitioner, which gave me the licensure to do not only the chiropractic work, but the regenerative medicine, the injections, and other things that we do in the office. So what is regenerative medicine? When did it start? And what does it entail? Regenerative medicine is a more natural approach to treating patients in that we're trying to get the body to heal to its maximal efficiency or maximal ability to heal. And so when you think of regenerative medicine, some of the earlier parts of regenerative medicine were prolotherapy, vitamin IVs, ozone therapy, and I'll be explaining each of those, which are things that we do. And then later on, as it grew, things like PRP, platelet-rich plasma, stem cells, and different lasers and things were also incorporated in the regenerative medicine field. A lot of what was done in regenerative medicine, because it is more of a natural thing, was never really patented by pharmaceutical companies, because pharmaceutical companies want to design a medicine that they can make their own, patent it, and then everyone has to buy it from them. With regenerative medicine, since we're using primarily the person's own body, such as PRP, you can't patent that. So there were never studies done, or there weren't studies done originally on regenerative medicine, and so it was never incorporated in general medical practice. So if you were to go and ask your doctor that you wanted to do some regenerative medicine, most of the time they won't know what it is or where to send you or what to do. And so as time has gone on, it's become one of the fastest growing parts of medical care at this time. People are more interested in a more natural, healthier way to get healed versus a standard pharmaceutical or a surgery. Essentially, we try and help people get healthy so they don't need the pharmaceutical and they don't need the surgery. That would be the basics of regenerative medicine. Regenerative medicine is currently being taught in some medical schools. And so it is becoming much more mainstream than it was 20 years ago. So I don't know if you can see this little sheet here or this banner, but I'm going to go through each one of these little things and explain them a bit. If there are any questions, they can be sent, and we'll try and address anything that we have. And we have a couple of people here watching that may throw out a question or two, which I will do my best to answer.
Before we do get started, we have a couple questions.
Okay.
What drew you to the regenerative aspect of the medicine practice?
What drew me is, I think, my chiropractic background, having a degree in chiropractic and nutrition and herbology made me much more on the holistic side. And so when we go into medical care, I was always more opposed to just throwing out a medication. I wanted to find out, well, how can we help this person? And so regenerative medicine just fit with my background as a chiropractor, a nutritionist, and herbologist. And to me, it just was a much better way of healthcare, personally. Doesn't mean that surgery is wrong, but it is overdone in this country. It's not necessarily that people don't occasionally need a pharmaceutical. However, there's a problem in medicine called polypharmacy, where they have people taking 10, 15, 20 medications, and their body gets so messed up with the interactions of the medication that they're worse off than if they never took any at all. Mm-hmm. And so, not that a medication is inherently bad, but many of them are overprescribed. And on a more holistic basis, if you can minimize the number of medications and do more things naturally, that's the basis of what regenerative medicine is.
Okay. What would you suggest to somebody who is currently taking multiple medications, and how would you be able to work with these people?
When you look at a list of patients' medications, you want to find out, well, what is each one for? A lot of times when you start with, let's call it a blood pressure medicine, and that blood pressure medicine has a side effect of causing legs to swell. And so then a person is taking a medication to get rid of the water that's in their legs. And then because of the water in their legs and the pain that they have, they start taking a pain medication. And so it kind of is a cascade. And so really to deal with that and is to find out, well, what is the real basic problem? Like, you don't want to just yank somebody's blood pressure medicine off. Their blood pressure will spike and then they could have a serious problem. Same with their blood sugar. However, if you were to say, well, this one is for pain and you can fix the pain problem, well, that takes that medication off the table. This one is for the swelling. Well, if we were to change that medication to a different type that didn't have the side effect of the leg swelling, then they would be only on one medicine, or instead of 2, 3, or 4. And so trying to focus in on the main problem and how to address it more naturally. For example, with diabetes, diabetes normally handled in medicine is first they start with metformin, and then that doesn't hold long enough, and then they add another medicine and then another medicine, and then pretty soon they're on 3 or 4 for that, and then they go to insulin injections. However, if you backtracked and said, well, what's your diet and your exercise like, and you were able to change those 2 things, many times you can not necessarily get rid of the diabetes, but you can control it on a much more natural basis, and then they don't need 4 medicines. Maybe they only need 1, or maybe they can get rid of them all for a while. Mm-hmm. And so you're just helping that body be healthier, and then it gets rid of the polypharmacy part of it, or at least it reduces it.
Thank you.
Well, thank you. Okay, so going to regenerative treatments, one of the original treatments way back in the day, they actually did some things with cellular medicine. In fact, you've probably all heard of people that had like leukemias, and how they would get chemotherapy, which would kill all of their blood cells, their blood bone marrow, and then they would do a bone marrow transplant. That's essentially regenerative medicine. Not the fact that they destroyed what you had, but the putting in a new bone marrow in a person allows their body to rebuild, and they no longer have leukemia. So that's been around for probably 30 plus years. In regards to joint care, prolotherapy is one of the first things that was done. Dr. Hackett, and I don't know the exact years off the top of my head, but in probably the 60s, 1960, 1970 area, he started experimenting with using just a form of sugar water and injecting that into torn or damaged tissues. Because the sugar water was an irritant, it would cause the body to react to an irritation, which brought the healing factors of the body to that area, and it would start to heal a torn ligament or a torn tendon or a chronic tendonitis. And so it would help the body recognize where the problem was and start the cascade of healing. And so prolotherapy has been along for a long time, but because prolotherapy was used somewhat cosmetically, somewhat with just a sugar water, and a lot of practitioners didn't believe in it, it was never brought into the insurance realm. And as long as something's not in an insurance policy, it's really not looked at in mainstream medicine. And so prolotherapy was always kind of on the outskirts, and very few doctors were researching it, trying to do that. And therefore, it took a long time for that curve to move over to where people would recognize it. So prolotherapy is one of the original regenerative medicines. Secondly, ozone therapy. Ozone is, we talk about our ozone layer that's around the world, and we think, oh, that's bad stuff. Ozone, when you inhale it, is not good for your body because the surfactant or the coverings of the lungs don't do well with ozone. However, other tissues really like it. And what ozone is, if you think of oxygen, oxygen is an atom, and it normally combines with another oxygen, that's O2, and that's what we breathe. That's what helps our bodies move around and function is the oxygen. Ozone is essentially three atoms of oxygen, but it's a very unstable element, and it converts very quickly from two uh, molecules of ozone to three molecules of oxygen, O2. That conversion is very antibacterial, antifungal, antiviral, and it also is still oxygen. Once it converts, it's an oxygen that we could breathe and use in our bodies. So if you take someone who has, let's call it a torn meniscus in their knee, and you were to inject ozone into that knee, the change from ozone to oxygen would kill any bacteria, any fungus, virus, or anything that's growing in there. And it also is going to oxygenate that tissue, allowing the tissue to heal more rapidly. Ozone is used a lot in Europe, Spain, Cuba, Mexico. And one of the reasons it's used is because ozone is very inexpensive to create. And if you're in a country that's poor, it's very easy to get a little ozone generator, and then you can make ozone and you can treat somebody without having expensive medicines. And so it's much more used in other countries just because of the ease of access and the cost, that it's much less expensive than other medications. It does take longer to heal. So if I was going to use, let's call it PRP on a knee, which I'll explain later, which is an injection coming from your own blood, that would heal the tissue much quicker and more effectively than doing ozone, but you could do several injections of ozone and essentially help that body heal. So ozone is another one of the more original regenerative medicines, and still being used, as I said, much throughout the world. Platelet-rich plasma is probably the thing that we do the most as far as regenerative treatments in our office. And platelet-rich plasma is we draw some blood, 2 tubes of blood, let's say, we put it in a centrifuge, and as it spins, it separates the red blood cells from the plasma and the platelets. The platelets are the healing part of your blood. So if you cut your leg, it forms a scab. The platelets are essentially what make that scab form and then bring the other healing parts of your body to that area so that it'll close the skin together and then you heal. Okay, and that applies to whether it's a damage in your liver, your kidneys, or whether it's meniscus in a knee or a rotator cuff in a shoulder. Okay. One of the problems we have with knees, shoulders, tendons is there's very poor blood supply. In our liver, there's a lot of blood supply. So if there's a damage there, there's a lot of platelet activity that can heal it. Inside the knee joint, because the body has the fluid that lubricates it, there's no blood going through. Therefore, there's no platelets. Therefore, there's nothing that starts the healing cycle. So if we can take it from your blood, spin it in a centrifuge and take the platelets and plasma and inject that to an area, that allows us to get that healing cycle started. And then the body will heal the damaged tissue. So PRP has grown a lot in the last 10 years. We were one of the first people that were using PRP about 10 years ago. And well, maybe 15 years ago. Time flies when you're older. If you remember Tiger Woods, Kobe Bryant, about 15 to 20 years ago, they went out of the country to get PRP done before PRP was really being done in the United States. And so they flew because they had the means to go do that. And they went to, I think one went to Sweden and the other went to Germany. And they were able to do PRP treatments. And that was the very beginnings of PRP as a regenerative medicine. Now, it's more accessible, but we've been doing it for a long time in my office. And I really love it. It's very effective.
How would you know, or how do you know when to treat someone with PRP versus the ozone?
Well, if somebody has the means, PRP is a much more effective treatment. Okay, so generally speaking, you're going to go for PRP because you can, in 2 or 3 treatments, you can take care of a problem, versus ozone therapy may take 10 and it may not heal as well. So you get a better healing with PRP. But if somebody doesn't have access, or if they're, or maybe they want to do prolotherapy with the sugar water, it just takes a few more visits. but it's a lot more cost effective. So that would become more a patient choice. If they ask me what's the better thing to do, I'm going to say PRP. If they say, well, I don't have the money for PRP, then I would say, well, we could do prolotherapy. It costs less, but it may take a little longer to heal. So that's kind of how I would go about that.
Okay. If for cash patients, what are the different tiers for the 3?
Okay. And one more thing before I answer that
sure.
question. The ozone therapy we normally put in just automatically in the injection anyway. So we put ozone in when we do PRP. We put ozone in if we're doing prolotherapy. So it's kind of, we just add it in because it's not expensive and it gives a little boost to what we're doing. So I kind of always do the ozone. I just don't sell it like that unless somebody said, well, I don't want anything except ozone. Then I would do it that way. So what does it cost? Prolotherapy, let's call it in a knee joint, would be somewhere around $250 to do a prolotherapy treatment, whether it be on the medial collateral ligament or inside the knee joint for the meniscus or a combination. That's about what it costs for that. And the number of treatments that would take to do a real true treatment program would probably be close to 5. Okay. For PRP, it's more about $600 a treatment, and you typically do 3. Could somebody do more? Sure. Do they need it? Not normally, but occasionally someone will need a 4th or a 5th. Some people are better sooner, but we kind of use 3 as a general thing so that we can say, well, for about $2,000, you can get your knee treated with 3 PRP treatments and such. That includes everything that we do. I know some doctors that have radio programs and they talk about, they don't use a number, they just keep treating until somebody says they're better. We kind of use 3 as a general statement. That way, most people are done with 3, and that gives them a better ballpark of to what to expect.
Okay, thank you.
You're welcome. So let me move on to another thing that I started before I even formed a medical corporation, which was spinal decompression. One of the most common causes of loss of work and disability in the United States is low back pain. Okay. It's second to common cold for the number of days lost from work would be low back pain. Many people go to a chiropractor. I'm a chiropractor. I don't necessarily market the chiropractic side as much as I used to because we do more regenerative medicine. But chiropractic, physical therapy, acupuncture, massage, all great things for your common low back pains, sprains, strains, and injuries. When something is not getting better with those types of treatments, many times you're dealing with a disc problem, or you're dealing with a stenosis where the spine has degenerated and now it's pressing more on a nerve. Non-surgical spinal decompression is a very special machine. It's the DRX 9000, which is like one of the best machines out there for it. Essentially what you do is you lie on your back, your knees are bent, there's a harness that holds the low back, another harness that holds the upper back, and then you can program the machine so that it isolates a specific disc. And then you get a pulling apart of those 2 bones. Essentially, I'm going to say 100 pounds for easy math. So if it pulls apart for 100 pounds for about 45 seconds, then it relaxes to 50 pounds for 30 seconds. Then it goes to 45 seconds at 100. So it's pumping that disc in a negative pressure. The disc is attached to the bones. So if you pull the bones apart, you're actually creating a vacuum on that disc. The disc is like a jelly donut. So if it's been squished, the jelly is pushing out and it can press on a nerve. And so as you're bringing those bones apart, causing the negative pressure, it will pull that jelly towards the center. And then the fibers that hold the jelly in can start healing. And that normally takes a number of treatments. It's usually, call it 3 times a week for about 8 weeks. But the success rate on it is extremely high, about 90% success in treating disc injuries, sciatica, all the non-responding types of things. If you have low back pain and you get an adjustment and it's gone, that's fine. But for someone who's been dealing with this chronic issue that's not responding, this is that step, that intermediate step before going to a surgeon, getting an epidural and having a back surgery or a neck surgery. It's very successful. I've literally kept 1,000 people or more from having surgery when they were told nothing could fix them. They'd already been to 3 or 4 doctors for their back pain, their sciatica, their disc problem. So it's a very, very good treatment for that, and I love it. I've had it for 15 years, and I wouldn't practice without that machine in the office. It just really, really works good. So spinal decompression, the DRX is just the brand name of the machine. Since this is one of the original machines, a much more high tech, believe it or not, even though it's about 15 years old. After that machine had been created, designed, um, the manufacturers Excite Medical, other different decompression machines were made, and in my opinion, they're not really as effective. They're not made with the same technology. It doesn't have the computers to be more specific. They're not as gentle as the DRX 9000 is. So anyway, maybe I'm biased, but that's the one I love. Okay.
Mm-hmm.
So that's spinal decompression. IV infusion therapy. Um, I think everyone can understand that our lifestyles, the foods that we eat, the water that we drink is just not the same as it was 100 years ago. And a lot of the chronic diseases that we have are due to the fact that we are not getting the nutrients. We are getting too many toxins. And so vitamin IV therapy essentially is putting in an IV, and then there are different vitamins you can put in. The common one is called a Myers cocktail. It has vitamin C, B12, B5, B6, B complex, calcium, and magnesium. And those are very good for helping kind of bump up those nutrients in the body. They have a little detoxifying effect. The magnesium is more relaxing, it can help with sleep. And then obviously if someone has anemia, the B6 and the B12 are very good for different types of anemia. So it is a very good thing to help bump up the energy, also help the muscles relax with the magnesium. And it is a very healthy thing considering that most people are not getting the nutrients that they need. And even if they are taking vitamins, many times they're not absorbing them well. So when you get a vitamin inside an IV, essentially you're getting it directly into your body, and it bypasses your stomach, so you don't have to worry about whether you're absorbing it or not. It's getting in you.
Mm.
So the IV therapy is very good. There are some specialty IV infusions, like you can use glutathione, which is very antioxidant. There's other things that you can add to an IV that is very, very healthy. And there is one newer thing it's a form of IV, but it combines ozone therapy with an IV, and that's called EBU, which is extracorporeal blood ozonation and oxygenation. So what that fancy thing means is it's a device, and you put an IV line in, the blood goes to this machine, and it ozonates the blood, oxygenates the blood, goes through an ultraviolet light, and then it comes back to another vein. As ozone is very antibacterial, antiviral, antifungal, and so is ultraviolet light. If someone has a chronic virus, like let's call it a long COVID, they've had COVID and they just haven't recovered. There's a lot of those proteins, spike proteins, and other things that are involved in the COVID, the vaccine, or the actual disease, either way. And people just didn't recover well. And you do the EBU treatment, and that ozone helps the body clear that up. It's very, very good for a long COVID. It's also very good for autoimmune diseases. Many autoimmune diseases, take a little sidetrack here. Autoimmune diseases, you would think, well, how did I get an autoimmune disease at 35? You would think if it's genetic, I would have had it when I was born. Why did it manifest when I was 35? We have a lot of genetic predispositions, which means that something is sitting there and it's just waiting for that opportunity. And there are typically, it's a combination of 2 or 3 factors that happen at once, which will kick in the autoimmune disease. For example, I've been working too many hours, and then all of a sudden I get a virus, and then I have an emotional stress at home, finances, or something with my spouse or whatever. And what that does is those 3 things kind of hit at once, and your body's reaction to it gets turned on and accelerated. And so now our immune system is on high alert, and that virus happens to have a certain protein sequence in it that matches our cartilage. And so all of a sudden the body sees that protein sequence and says, oh, that's a foreign thing, we got to get rid of it. and it starts attacking a specific part of your body. For example, rheumatoid arthritis, where you have all that joint, the body's attacking the joints. And that's because perhaps the virus that you had or the bacteria happen to have certain sequences that were very close to certain sequences in the cartilage. And so now the immune system is confused and it attacks that joint. When you get rid of that virus with EBU, through several treatments, then the body's immune system can calm down a certain amount, and that allows the body to heal better or to not react quite as strong, and therefore you function better and your body not tearing itself up. So for ebook therapy is very, very good for autoimmune diseases, for helping chronic fatigue syndrome, fibromyalgia, anything where you're dealing with a chronic condition that your body just hasn't quite gotten over. It takes care of the viral component, but it also is hyperoxygenating the tissue, which allows tissues as well to heal better, faster. So it's a very good treatment. It can be used as an adjunct to certain cancer treatments. We don't treat cancer in our office, but I have several patients who are undergoing the treatments, and the high dose vitamin C is very good for that, or the EBU treatment is very good for helping them deal better with the chemos or the results of a chemo after they're done with their treatment to recover faster. And so it's a very, very good treatment to use in adjunct to some of those aggressive care therapies that need to be done. So that's IV infusions. Perineural injection, it's a very, very interesting treatment. You use a very low dose sugar water. Essentially, it's the same dosage you have in your blood system. So you use a 5% glucose or dextrose. And what you do is you're palpating and you're finding the little branches of the nerves that are just underneath the skin. A lot of times what can happen is that as we get tense, let's call it, or as we have micro traumas, the body forms fibrotic tissue around, and so it's kind of constricting and not letting the blood flow and the nutrients get to those nerves, and the nerves become very hyperactive. So they're sending signals at a much higher rate than they should. And so the body now is feeling a lot of pain or strange symptoms that they don't know what it's about. And when you inject, what you're doing is you're trying to open up the area with just a little bit of this sugar water. And so it takes the compression off of the nerve, and that sugar water feeds it. It's kind of like the Snickers bar for the nerve. And so it just kind of wakes it up and allows it to have a good snack. And so it calms it down. So it's a very, very interesting technique that very few doctors use, but it's kind of interesting to see the reaction with just sugar, nothing else but a little bit of sugar water, and you get a really interesting response with that.
What kind of patient would see you for that?
Usually when we're dealing with that, it's a patient who has chronic condition and no one's figuring it out, which happens a lot in my business. People have been to 2 or 3 or 4 doctors. They have these pains and they get psychotic, they get a medicine for their psyche versus something else. The doctor figures if I can't figure out what it is, it's got to be in your mind, and they give them some kind of antidepressant or a pain medicine, and they're never addressing what's happened because it's not something that's commonly dealt with or that most doctors would look at. And if you look at our system, you typically have like a primary care doctor who's a general doctor. And so it's his job to know essentially everything that could happen. And if he comes up with something he doesn't really know the answer, he wants to refer you to somebody. But if it's a nerve problem or a vague pain, they want to send you to a pain management doctor or a neurologist. Neurologists are looking for, well, is it MS? Is it a nerve problem being pinched from a disc injury or a tumor? And they don't really look at these more finer problems like the nerves being entrapped just subdermally. It's not something that's really addressed medically. And so when people come in, I'm kind of fact finding to find out what's going to be the best thing for that particular pain. When you get a very vague symptom, that's more something that would be there. If you can track it down to a specific nerve, then you go, oh, that's coming from the neck. but when they just say, "Oh, my whole arm is hurting,"
Mhm.
well, that's odd. It's normally not a nerve. It's nerve, but why isn't it following one specific nerve? And so you can track down and find out that it has to do with all these little fine branches that are spread out, and you can track those and treat them. And it's a very shallow injection, a very, very small needle. Doesn't really hurt at all, but it can have a pretty significant effect. Similarly, if you're familiar with acupuncture that deals with energy meridians of the body, there's an energy flow, and a lot of it happens right in the subdermal tissue. Okay. They've done some very interesting studies where they stimulated an acupuncture meridian point, and then they were seeing when it registered on the brain, and they found out that the register was like instantaneous, that it was faster than a nerve can travel. And so they were trying to figure out, well, what's going on, because it's not a nerve thing, it's energy, which essentially energy travels at the speed of light. Obviously, it's going through tissue, so it might not be that fast, but it's almost instantaneous. And so with a lot of things like the perineural injection techniques, with some of these other things, you're getting a response that is more an energetic, although obviously we're putting in some sugar water, but we're treating some things on an energy level in many instances, kind of like that. And when you deal with somebody, let's say, that has a scar, and a scar is going across the skin, and that can block an energy meridian. And so sometimes doing that perineural injection technique along a scar will help allow that energy to now flow like it's supposed to. And so that can have a dramatic response in other parts of the body you weren't even looking at, just because of energy meridians, which don't follow our normal Western medicine pathway, if we would call it that. Okay, a little sidetrack there. Nutrition. I'm not going to spend a lot of time on nutrition. Our nutrition in the United States is terrible. You need to do something about it, whether it be coming to a doctor like myself, supplementing. You need to find somebody that knows nutrition and really knows how to look at what you need, not just the FDA recommended stuff, because that just really isn't nutraceutical. A nutraceutical meaning you're treating something versus just generally taking something because you want to take something. So if you have a condition that you're feeling, you need to go to somebody who knows nutrition enough to say, you need this for your liver, or you need this for your lungs, or you need this because you've got some sort of an underlying pathogen or something like that. And then you can get more specific, which I do. And that is also, I would call, regenerative medicine. But
Yes.
we do deal a little bit more at this point with more of the injectables. Back about 20 years ago, I did a lot of herbology and nutrition, and I still do it, but it's not as big a part of the practice as it used to be.
Mhm. Yeah, the sad can make us sad.
Pardon?
I said the sad can make us sad. The standard American diet.
Yes, the standard American diet is sad, very, very sad. So those are all more of the, I'm going to call, the medical side of pain, disease, injury type of stuff that we do in regenerative medicine. Okay. We also do some cosmetic things, and some of them are more, I don't know if you would call laser treatments all regenerative. If you're trying to get rid of hair, like a hair removal, that's not necessarily regenerative. You're actually killing hair follicles. And so some of them don't fall into true regenerative medicine, but they are part of aesthetic care, which we do. And some of it is very, very interesting stuff. So let me talk a little bit about this lovely lady, who happens to be my wife. So this is Sandra. And this is a before. I don't know how well you can see it on that little camera. Okay. So there's a before and an after picture, and I hope you can tell the difference. Which one is the before and which one is the after? But essentially, there's a new technique with PRP that you can use PRP as a filler technique. So if you were to go to a doctor that deals with fillers, they're typically going to give you either a hyaluronic acid-based filler you want me to hold that now?
Oh, I was going to give it to the details on the left.
Oh, I'm sorry. And so some of those
It's
fillers
backwards.
are not as natural. I mean, hyaluronic acid is a natural product, but it's not naturally in a big old bunch inside your face, okay, so to speak. And so a lot of people that get that end up with feeling more like a little bit of concrete inside them than they feel a normal feel of their face, you know, the natural texture that you're supposed to have. PRP, platelet-rich plasma, you can separate part of the plasma out and heat it, and it's almost like you're heating an egg. An egg will get hard, firm, okay? And so you can mix that in with the other part of the plasma you didn't heat, and so you get a thick gel that you can use as a filler, and it's coming from your own body. And so you can use it in the nasolabial folds here or underneath the eye troughs. Any place you would use a regular filler, you can actually use platelet-rich plasma in that form. And the benefit of it is, one, typically it's less expensive for a treatment, one treatment, than it would be regular fillers. It's about the same to do two, and you normally do need two of them. But you're using a product that actually helps regenerate some of the collagen in your face. So you're not only filling the areas that you want to fill, but you're actually healing some of the tissue. And so instead of just putting in something there that sits and eventually gets absorbed and goes away and then you redo it, this is actually helping the face heal inside. And so you have a better face when you're done with it. And you may have to repeat it, but you know, once a year or something like that, but you're actually making the face healthier versus just putting in something that's foreign. And so it's a brand new technique. It's barely been used probably within this year. Well, I shouldn't say this year because we're only in February, within the last year. Okay. But the results are very good, and it's not painful to put in. I was very, very hesitant when I learned this technique, that I thought, man, that's got to hurt when I saw it being done. And I asked my wife when we did it with her, she said she didn't feel it. It was essentially painless. You put a little bit of a lidocaine in where you're going to start, and then you don't feel the rest of it because it's going between the planes of the tissue versus sticking a needle in everywhere. So it's a lot less painful than you would think. Very, very little pain at all. So very cool technique. One of the newest things in the regenerative aesthetic market. Okay. Yes.
You're talking about platelets and plasma, so that's a separation in the blood, correct?
Yes.
Okay, and so do you guys do that on site, or do
Yeah.
you come in? Oh, you do? Oh,
Yeah.
okay, so you draw the blood from the individual?
Mm-hmm.
Okay.
We draw it, we put it in the centrifuge.
Mhm.
Essentially, we discard the red blood cells and we're using the plasma and the platelets.
Oh, okay.
And depending on what we're doing, for example, if we're doing a knee, that's a very quick process. It takes 10 minutes to draw the blood, spin it, and have your product ready for an injection.
Okay, and why would you use that on the knee?
Because
Is that like a rejuvenative, like?
yeah, it can help repair tears in the
Wow.
meniscus for people with a lot of arthritis where the tissue is kind of like scraped and irritated. It will help heal part of that tissue. It's not going to take a meniscus that's completely gone and make it new.
Okay.
But most people, you don't need to move them back 40 years. You only need to move them back 5 years.
Right.
And it can do that.
Oh,
It's
okay.
very effective at doing that. And
And how long is the treatment? So it would be the same duration for about a year, and then you would come back in.
now, well, let me answer that in two parts.
Okay.
We decline about 5% a year as far as
Okay.
cartilage is concerned.
Okay.
So let's say that you had a knee pain, it was torn, wearing down, degeneration.
Mhm.
Okay, so the PRP is going to help move you back a little bit, but the degeneration process is going to continue. I mean, that's part
Okay.
of life.
Right.
So if you were to do one treatment a year, you would more or less maintain. It's kind of what they say.
Oh, okay.
Now, if you're dealing with like a torn meniscus where it's a tear,
Yeah.
that you can heal, and that's not a degenerative process, that's a trauma process. When that's healed, that could last for a number of years.
Oh, okay.
And I'll use myself an example. Sorry to bore Lanisha, but she's heard this story. About 8, maybe 9 years ago now, I was running by my house. I was hit by a car, and it was a very, very bad accident. I threw me about 20 feet, maybe more, and broke my leg, tore my ACL, damaged the meniscus, rotator cuff on my shoulder, punctured my lung, broke some ribs, and some disc injuries. So it wasn't a good day. After my lung was healed, the doctor said, "Oh, you can go back to running whenever you want in 3 weeks." So I said, "Oh, great." So I went out running about 3 weeks after the accident, and I was going, "Gee, why is my leg hurts so bad?" And it was because I had a broken leg and a torn meniscus, which was kind of dumb on my part for not investigating it more. But when you go to the emergency room, they don't look at anything but what's killing you. So they never took an x-ray of my leg. They never did an MRI of my knee or anything. And so I kind of woke up and I said, well, I better investigate that. When I did, I found the damaged tissues and the other problems. So I ended up doing PRP in my knee, 3 treatments, which is normally the series we do. And I went about 7 years. I ran 2 marathons and about 7,000 miles, and I still don't have any knee pain because it was not a degenerative process.
Case. It was
a tear that was healed, and
repairable.
Essentially I was back to normal. So that's more the musculoskeletal side of the plasma that we use.
Okay.
On the aesthetic side, we're trying to rejuvenate. That's more of a degenerative process typically, because we're dealing with people whose faces essentially are degenerating. Mm-hmm. And so you can do things that can help regenerate or repair that. There's PRP microneedling, where you essentially use a little buzzer that's got a bunch of different, I'm going to set this right here for a minute. Essentially, there's 2 ways. There's just microneedling, where they use like either a roller or use a little needling pen, and it's got several needles on it, and it just makes little holes. And then you put the PRP over, and it absorbs in. So that's PRP microneedling. Fairly simple to do. Some places don't do PRP because their licensure doesn't let them. And so they'll use hyaluronic acid, or they just do the needling.
They're limited to be able to provide the regenerative service that you do.
Right.
Got it.
And then there's also radio frequency microneedling, which is a little better technique, because essentially the needle is going in, it's creating a little like heat in there. What you want to do to regenerate tissues, you need to damage it so the body responds and tightens. So most of the time when you're doing microneedling, you're trying to tighten the skin. You're trying to heal the tissue, rejuvenate it. And so to do that, you have to stimulate it. And that's usually with trauma, with a needle, essentially little microneedles. And so you can use radio frequency microneedling, which we have in our office, which is the more advanced technique of doing microneedling. You can do
And does that break the skin, or?
Yes, it does,
it
but
does.
you don't look you look red after you're done. There might be just a couple of little spots of blood, but because it's got that radio frequency, essentially it's just sealing it right at the same time. Okay. And so you're not turning all bloody, so to speak, which can happen with some people that do aggressive microneedling. Okay, you see them after the few days and they look like they've been through something. With the radio frequency, it's a much gentler way to do it. It creates the same amount of stress, I would say, but you don't look like you were beat up. Okay, so it's a quicker turnaround to getting back to whatever you want to do. So that is a very, very advanced and great technique for helping just tone the skin, making the skin look newer, younger, healthier. Okay.
I have a question.
Sure.
All right. So you're talking about microneedling and activating the skin, so that way it'll be like a call to arms, to where it'll be like, oh, we got to heal that. Would that work if you have an apron? Would that work on that?
Well, there's different things depending on what you're trying to do.
Oh, okay. What type of skin?
Yeah, it's because that's such a microneedling, you're not going to get much of an effect on a larger area.
Oh, I see. Okay.
Okay. There are other things that work better.
Okay.
Okay. For example, there are certain lasers that are much better for tightening the skin than microneedling. It would take a lot of microneedling to tighten up,
that body of work.
That amount of work. Whereas if you do certain lasers, they have a better response technique. There are more aggressive plasma type not injectables, but essentially like needling. You don't with the plasmage, which is another device. it's not really a needle. It sends essentially almost, I would call it like a spark, but essentially it's a plasma energy. And so it goes deeper and it tightens better.
Oh, okay.
So you can do that. I use that as far as getting a larger area. Or if you have a bigger, wrinkle, let's call it, micro needling is good for the finer wrinkles, but it's not going to get a real deep wrinkle. And so then you look at more like a plasma type treatment that can do that.
And is it good for scarring?
Yes, you can use there's so many different laser energies now that they have developed. Certain frequencies work for like the spider veins. Certain frequencies kill hair cells. Other frequencies regrow or stimulate hair growth. And other frequencies are used to tighten this tissue. And so it depends on what you're trying to accomplish as to which machine or which frequency you would use. So we have a lot of devices at the office depending on what a person's need is. And that allows us to design a program for you, which would be different than a program for somebody else. We don't just put everybody in the same package. What is going to make you get the thing that you want, whether that be a better look, whether it be getting rid of your pain, or whether it being allow you to continue a sport that you haven't been able to do because of an injury. And so they all have different ways to address them. So I did kind of go into plasma facial. That's the plasma energy that we just talked about. Facial microneedling, laser hair removal. And I would say, if you were to say which things hurt the most, laser hair removal hurts more than about anything else you do, because you have to essentially kill a hair follicle. But hey, looking good also can, sometimes it's a little painful. But once you're done, you do several treatments, then the hair is now fine. It's no longer coming back. We had a young girl, she was probably in her mid-20s, who literally had a beard. I mean, and it was a hormonal issue that caused it, And so we treated her, and it took about 3 treatments, but she no longer had to shave, to go to work. And that's a big deal for a lady.
Yeah, especially if it's not the aesthetic or how you feel about yourself.
Yeah, so it was a very, very big deal for her, just because you don't want to have a 5 o'clock shadow as a young lady. Just wasn't good. And so it can be done essentially, but a couple of things about hair removal which are interesting. Like, I'm a lousy candidate for hair removal because I'm light skinned and I have light hair. The darker the hair, the easier it is to get rid of. The lighter the hair, if you're gray, white hair, blonde, those are the harder hairs to get rid of than someone who has dark hair. And it's because the light energy is attracted to the dark color, the melanin that's in the hair follicle. So for whatever that does for people, it just is, that's the way that life is. Some people, treatments work much better for than other people. Hair restoration, which is the opposite side. People don't like to go bald just as much as they don't like a hairy leg or whatever it might be. And with hair restoration, there's a couple of things that are important. One is you have to have a hair follicle, because you can't create something that doesn't exist. You can't make something grow better that's not there. And so when hair starts to thin, those are things that you can do to help keep that hair and to help the hair go through a quicker cycle. Because what happens in some of the baldness, the hair follicle has about a 4 to 6 week cycle where it grows and it goes dormant, goes dormant. And sometimes the hair goes dormant for 2 months or 3 months. And so it's not regenerating enough. And so more hair falls out because it's not regrowing. And so then you get those thinning things. And there's a couple of different devices that are very good. There's lasers that work. You can do microneedling or essentially PRP to stimulate hair growth. And then there's also some other machines where they can essentially ultrasound in, like exosomes or different things like that can stimulate hair growth. So there's a lot of different ways to help that. But
is that painful?
No, well, microneedling or using PRP as an injectable, you put essentially a lidocaine cream on the head, and so you really don't feel it. It's not that big of a deal. with the it's more of a aesthetic treatment with the ultrasound that you don't feel at all. I mean, that's almost like going to a spa and getting a nice head massage. So it's very, very pleasant to do that one. Okay. And so, and let's see. But if your hair loss is due to a bad thyroid, one of the signs of thyroid is brittle hair and hair loss, loss of the outer thirds of the eyebrows. Um, you're not going to get a good response if you don't fix the underlying problem. If you have a big hormonal issue, you know, you got to fix the hormone problem, or you're just constantly trying to bring something back that's being beaten up and taken away. And so you want to find out the real cause of it, and then you'll have a better success in a success. And then you don't have to come just all the time to get something fixed if the problem is already taken care of. So those are some of the things you want to do with a hair loss problem, is finding out, well, why? Is it genetics? My grandpa was bald, my dad was bald, and I'm going bald. Well, you're going to have less of the ability to fix some of the genetic portion. You can prolong it. You can keep yourself going a lot longer, and you can help overcome some of it. Some of us are just destined not to have hair, and other people, you know, are destined that they're going to have it till the day they die, and they don't have to do anything about it. You know, part of that, you can swing the pendulum a little bit, but there are some things that are just there, and you have to figure out, you know, other than hair transplants. If you have no hair follicles, hair transplants is the only way to really get hair, and that's not a cheap or pleasant experience to go
And
through.
that probably is painful.
Yes, I would assume it is. They individually transplant hairs, and that's a lot of work, and they apparently charge for each one of them. So I don't know what it costs. Okay, cool sculpting. We got rid of our cool sculpting machine and got what's called True Sculpt. So let me explain a little bit about what that is. So if somebody weighs 300 pounds and they say, I want my body contoured, I'm going to tell them, no, go on it. We need to work on the diet first. But let's say they're reasonably close to the weight they want to be, but they have bulges and things they don't like. That's where body sculpting becomes very, very good. Okay, whether it be cool sculpting, true sculpting, and some of these other things, what you're doing is you're either heating or cooling the fat, and the fat cells are more sensitive to heat or cold than other tissues. So we have the True Sculpt, which is it's essentially a radio frequency. It heats up that tissue. As you heat the tissue up, the fat cells will start to die, and the body will just resorb the fat. You know? But it doesn't kill the skin, and it doesn't kill the organ underneath it. It's only affecting the fat tissue. It's that temperature. And then you'll lose about 20 to 25% of those fat cells. Fat cells do not regenerate. And so if you kill a fat cell, essentially it's gone. And so if you take 100 fat cells, kill 25% of them, you have 75% fat cells of that area. And so it allows us to contour an area that and make yourself much more aesthetically pleasing to that area, instead of always having a little bulge in the bottom of your stomach where everything else looks good and you go, I just don't like that spot. That's where True Sculpt comes in. Okay. Excuse me. I've been talking a lot. I'm not used to talking that much. And I've already explained the Botox and the fillers. Well, I did explain Botox, but Botox is a poison, okay? Botulinum toxin. And what it does is it paralyzes a muscle. So if you have chronic wrinkles and you get the big furrows in your forehead or in between your eyes, then you can use a little Botox in there, understanding that it is essentially not a healthy thing for you, but it does accomplish the goal if you're trying to get rid of a wrinkle. And so if this is no longer wrinkling up because you've taken that muscle and relaxed it, the wrinkle will essentially disappear over a certain amount of time. Now, will it come back? Yes, you know, as the Botox wears off and over time, as you're frowning or doing whatever that motion is, you can get the wrinkle back. So you can kind of maintain it with the periodic treatment. Now, there's Botox, which looks natural. And then there's Botox that you see on TV, where you see people and they have essentially nothing happening on their face. There's no movement at all. And so that, Lanisha's laughing, but that happens. People can get kind of, I'm going to call it over the top. And so they don't, you wouldn't know if they're mad or happy. They just have no expression because it's just all plastic. And so what we try and do in our office, if someone wants Botox, is we're trying to make you look natural. We're not trying to make you look like an alien or look different than you were designed to look. We're trying to soften those wrinkles, make you look younger, healthier, not make you look expressionless. And so that's just my little 2 cents on Botox. Now, Botox is interesting because it's also being used for chronic migraine headaches and from other things. And essentially what they're using it for is to get the suboccipital muscles that are pulling in the back of the scalp. You know, if somebody has a chronic tightness, that can trigger a headache. Or sometimes a TMJ that has been clenched so long that they can't relax it, and that's triggering the headache. So you can use Botox as a therapy for that type of an issue. Okay, so I think I've explained regenerative medicine pretty well. Are there any questions? Because I just spoke longer than I thought I would.
If someone had regular filler and regular Botox, what interactions might happen if they switch to the PRP fillers?
There's no problem. Essentially, when you go to get a filler again, the filler you had has pretty much been dispersed or absorbed. And so there's not a problem with going from a regular filler to the PRP filler, or to go from, let's say you did a lot of Botox and you wanted to not do Botox, you wanted to do some of the other laser techniques to tighten up the skin and maybe cut down on the amount of Botox you're using. Yeah, it's just a matter of switching or using less Botox the next time because you had done too much and you thought, you didn't look normal. So that's just a matter of adjusting to those things. Is that good?
Very good.
It's wonderful.
Well, thank you so much. I really appreciated being here, and I enjoyed the conversation and the explanation.